Hello, Dayna Johnson here, your Dentrix Office Manager. I'm here with Mary Govoni. We're at the Speaking and Consulting Network, and Mary is a specialist in hygiene, ergonomics, and I wanted to give my audience a little bit more variety. So we're going to be talking about hygiene and what we can do as far as helping our clinical team be a little bit more successful and saving their bodies. So Mary, so first of all, let's start with the scheduling coordinator. So how can the scheduling coordinators help the hygienist as far as maybe mapping out her schedule so it's a little bit more beneficial and helpful for her?
That's such an important thing, Dayna. The scheduling coordinator needs to be aware of the difficulty of the types of procedures that the hygienist is doing. And so if they can map out their schedule, create a matrix, if you will, that doesn't book the hygienist with back-to-back difficult procedures. So we wouldn't want the hygienist to have 2 or 3 scaling and root planing appointments in a row, especially if they were even going to do a full mouth of scaling and root planing at one time and then start with another patient right after that, because they're going to have some hand fatigue and they need a chance to have a little bit of a break. So not scheduling difficult procedures back to back is the most important thing.
Good idea. So what is the number one thing that our hygienists or even our dental assistants can do to really help their bodies to stay in the best healthy shape as possible throughout the day?
Most important thing is to make sure that they're very careful about their posture all the time when they're doing procedures. Now, they can't be in perfect posture, sitting up really straight and with their shoulders and arms in neutral position all the time. Sometimes they have to get out of good posture, but if they can set a goal for at least 80% of the time to be in good posture, which means for the hygienist trying as much as they can to work from a 12 o'clock position behind the patient, to keep their back straight, their head as upright as they can, shoulders down, elbows in, not raising an elbow, not stretching around all the time for the procedure. They have to do it sometime. And for the hygienist, using magnification, wearing loops makes a big difference. Sitting all the way back, not on the edge of their stool and not straddling. The assistants have a little more of a challenge because their posture is so affected by the doctor's posture. And so they almost have to have a sit down with the doctor and kind of call a truce and how they're going to sit so they can both be comfortable at the end of the day.
Yeah. How much of that do you think is affected by the chairs that they sit in?
Oh, it's so affected by it. The patient chair, how wide and how thick the patient chair is a big, big factor, because if the hygienist can't get their legs up underneath the back of the patient chair, they can't sit very close, and in a lot of cases what they do is sit a little further away, which makes them lean in, and they also straddle the back of the patient chair a lot, which is really bad for their hips and low back.
So if somebody in my audience wanted to maybe have you come into their office or do kind of an assessment or consultation, how could they get a hold of you?
They can contact me on my website, marygovoni.com, or they could call my office, and the number is area code 517-347-7903.
Great. And I'll also have Mary's information on the bottom of my blog for today also. Thank you.
Great, thank you.